Thank you for tuning in to WDRB Media, the voice of the community, the only station giving you double the information and inspiration. I'm your host, Purity Stockton, and you're listening to Empowering Minds Radio. Today, we're going to talk about mental health and our youth. Mental disorders among children are described as serious changes in the way children typically learn, behave, or handle their emotions, causing distress and problems getting through the day. Common disorders are ADHD, also known as Attention Deficit Hyperactivity Disorder, anxiety, and behavior disorders. And I am so excited today to have my co-host with me, Dr. Vanessa Bowes. I'm so excited that she joined me today to talk about mental health and our youth. Let me tell you a little bit about Dr. Bowes. Dr. Vanessa Bowes is an author, entrepreneur, psychologist, and a parent of a very special child. She has extensive knowledge in the fields of psychology and education and has worked with special needs children for the past 15 years. Dr. Bowes is an advocate for children with special needs and works tirelessly to aid the community and parents in navigating the schools. Dr. Bowes is the founder of One Touch Psychological Services, where she provides comprehensive assessment, therapy, and consultation services. Dr. Bowes is the author of the newly released children's book, Gabriel Tries Out. So this is her book. It's Gabriel Tries Out. Vanessa is the parent of her very own Gabriel, who is a warrior fighting cerebral palsy every day. So welcome, Dr. Bowes.
Thank you for having me.
I'm very glad that you joined me today.
I'm so happy to be here.
So we want to talk about youth and mental health. First, I want to ask you how prevalent, how widespread are mental health disorders in our youth?
Mental health disorders are actually more common than people think. About 20% of Americans have some form of diagnosable mental illness. And as you stated before, when we talk about mental illness, it just means that there is something going on with your thinking, your regulation of your emotions, or your behavior that is causing some type of distress. So it's common in the population in general, and as well as in our youth. That same 20 to 25% of our youth are able to be diagnosed with some type of mental disorder.
And what are some contributing factors?
That's a really good question. So science tells us that mental health illnesses are a contribution of both your genetics as well as your environment. So you are genetically predisposed to some types of mental illness just at birth. And that's why it's really important for us as families to discuss our medical history throughout our family. And it's not limited to just who had diabetes, who had high blood pressure, but who had anxiety and who had depression, because those are precursors to things that may happen to you. So you may already be predisposed to some type of mental illness, and then there can be environmental factors that also trigger that. So if you're in a highly stressful environment, if you're exposed to a traumatic event, or if other things happen, those can increase the probability of that mental health disorder kind of coming to light.
And what can families do when they kind of see some signs?
It is important to notice the signs. So especially with our children, in 2020, there's a lot going on. Our kids are exposed to a lot. So first, families have to be very observant of their children and notice when differences occur. When your child is normally one way and you see them being something else. It's hard to just pull out symptoms from the DSM or what are typical, but you need to look at your child and changes occurring in your child. Some children, just by nature, they have a personality that's a little bit more withdrawn. They're not social, they don't talk to people, and that's just who they are. But when you see drastic changes, when that personality goes into a deep withdrawal, they really don't want to talk to anyone, they're being very secretive, they're not socializing with family or friends or doing anything fun, then you need to take note of those things and ask questions and talk to your children and ask them what's going on. And if you do feel like there may be some mental illness at play, definitely talk to your physician about what they may see, as well as mental health professionals, licensed clinical social workers, psychologists, counselors, just to get an idea of if further intervention needs to happen.
And I work in schools, and sometimes people ask, or they wonder, is there a way to really prevent?
My answer to that would probably be no, because if there is something that is there in your DNA and your genes, it's not able to be prevented. And that's a huge burden that I feel like we put on someone to say that this could have been prevented and you did something wrong. That's making the families feel like they are to blame. We can definitely learn how to live with those. As you stated before, I have a daughter who has cerebral palsy. So she has a physical disability that sometimes people try to say, well, it was because of this or it was because of that, and place fault in it. But I just accept it as what it is. And what we're learning how to do is just navigate life with cerebral palsy. It's not going anywhere. She's going to have it, but we can maximize her life potential. And the same thing with anxiety, ADHD, depression. If it's there, it does not necessarily mean that your child can't do certain things or whatever they want to. You just have to learn how to navigate life with whatever situations that your child may have.
And what are some different, we've mentioned ADHD, we've mentioned anxiety. What are some other ways that mental illness in our youth can manifest?
You know, I think that one that we don't talk about that we have been mentioning is the anxiety. I think we spend a lot of time on ADHD and we spend a lot of time on depression. And what I have seen also working in the school district is there are a lot of children who manifest anger as a symptom, anger, aggression, irritability, and sometimes, particularly in African Americans, that is a symptom of anxiety, and we're calling it anger, and we're giving them these ODD labels and conduct disorder labels. And sometimes the root cause of all of that is trauma that they've experienced and them being in a constant state of worry, anxiety, not knowing what's going to happen next. But big things that I do see are anxiety, the attention problems, which could also be other things. When we worked together too, I remember there were a lot of children who were inattentive, had difficulty paying attention, and sometimes when you dig deeper into it, it can be the result of lack of sleep. So sometimes there are other issues that we are trying to look at one or two symptoms and say, oh, it's this, and that's the need for going to talk to your doctor or other mental health professionals to really dig down and make sure that we're not missing anything. Because when you lack sleep, it looks a lot like ADHD. You're very inattentive. Yes. It's hard for you to focus. You're very distractible. You're irritable because you're tired. And sometimes that's the issue with some of our children as well. We also see a lot of depression, prolonged periods of sadness, and it's not usually attached to an event. You know, there is grief. And so if something happens that a child is grieving, that's very different than depression. Depression is a prolonged state. Usually before we diagnose it, the child has to be in that state for weeks, where they're showing sadness, withdrawal from family and friends, lack of interest in things, talking about hopelessness, mentioning suicide perhaps. So you're looking for things like that. Even the suicidal conversations without the depressive symptoms are things that you need to pay attention to. Cutting behaviors as a coping strategy. A lot of children are using the pain that they're feeling from cutting kind of soothes them, and it doesn't sound like it makes sense, but it does. It kind of takes away that emotional pain and gives them a physical pain to focus on. So we also see some of that. And there is a small growing population of kids who are looking like they are bipolar. We don't normally diagnose bipolar disorder until the late teens, but there are a lot of children with kind of those erratic emotions that we're seeing that in. So not necessarily to run out and get a diagnosis, but just to pay attention to those symptoms. Because before we even have a diagnosis, we can just deal with the symptoms that we see and try to work and treat those things.
Right. Do you see a lot of onset in children 5 and under?
I do. I have worked in preschool kind of special education. So you can see some symptoms of things when children are young. So you're looking for developmental delays in all areas. So even if like walking and talking are developmentally appropriate, you're looking for developmental delays in their emotional regulation. So young children who have really difficult time controlling their emotions, and this is all out of proportion for their age range, because a 3-year-old, of course, is going to have tantrums. That is absolutely developmentally appropriate. Right. But when you're noticing that these tantrums are long and they're difficult to come out of and they're happening very frequently, those are things that you want to pay attention to. I don't really like to diagnose that young. If possible, we can definitely get in with some treatment, but I don't like to give those
other kind of
labels that young, because sometimes children look one way when they're really young, and then as they grow, they kind of grow out of some of those things that we saw and into something else. So I would reserve diagnosis unless it's something that's crystal clear. Like a lot of times children with autism, you can see that really clearly younger. But other things, sometimes we want to wait a little while, still intervene, but wait to give that diagnosis.
And as we were preparing for today, I looked up a statistic from Child Mind Institute. Mm-hmm. Mental health disorders are the most common diseases of childhood. Mm-hmm. Of the 74.5 million children in the U.S., an estimated 17.1 million have or have had a psychiatric disorder. Mm-hmm. That was alarming. Yes. And these days, it just seems like that's a high number.
It is, and I think sometimes we focus a lot on medical health, and we don't talk about or focus our attention on mental health. And there are a lot of things that children are exposed to now that we weren't exposed to, with social media and all of the access to everything that goes on in the world that kids are able to listen to, which is why I probably think that anxiety is the number one disorder, right, because kids know so much and they hear so much and they absorb so much, and even
not ready for it.
They're not ready. Their little bodies and minds aren't ready to process it. And as parents, we try to hide things and shield things from them. My daughter mentioned the other day about the coronavirus and are we gonna die? Because all of this stuff is out in the media, and right, even though I don't pay it much attention, she's hearing that, and I don't know how much of an effect it's having on her.
Yeah, that's what I was thinking about with anxiety and mental health. And these numbers, I was thinking about now with social media and technology and everything that our kids are exposed to now. Mm-hmm. And I'm wondering if I know that's contributing to the onset and all the high numbers and everything that they're in contact and exposed to these days. Mm-hmm.
Yes, and we as parents and adults and, caring members of the community, we need to process things with kids. So they're hearing all of this stuff and seeing all of this stuff, and they don't have anybody to process it with them. And to even the coronavirus example, you hear all this stuff about it, but are we having conversations that, yes, coronavirus is a dangerous illness and some people have died from it. However, the probability is really low. And if we do these things, then we'll be fine. Balancing that off. So making sure that with all of the information our kids are exposed to, that we're talking to them and talking through them with things that they may be worrying about, and even asking the question, is there anything that you're worried about? Is there anything that you've been thinking about? Is there anything that you want to talk to me about as your parent that I can kind of help you work through? Bullying in the schools is another big issue, and with social media, it adds another layer to bullying, because we can't always contain it at the school. Things are going on outside of school, and then they show up at school on Monday, and we have no idea that this stuff has happened. So just talking and processing through will definitely help.
You mentioned earlier some of the signs that something is wrong. You mentioned withdrawal. You mentioned, noticing different behaviors out of the norms. What are some of the treatments and supports that